Welcome to Chapter 11, where we're going to be going over poisoning and substance abuse. Some of the competencies and familiarities that you should obtain or achieve during this chapter per the National EMS Education Standard. In toxicology, recognition and management of carbon monoxide poisoning and nerve agents poisoning, how and when to contact Poison Control Center. And immunology, recognition and management of shock and difficulty breathing related to anaphylactic reactions. In your pharmacology, it uses simple knowledge of medications that the EMR may self-administer or administer to a peer in an emergency. Within the scope of practice of an EMR will cover how to self-administer and administer to your peers. You should be familiar with names of medications within the scope of an emergency medical responder, their effects, indications, routes of administration, and the dosages for the medication administered. So what is poison? Poison is a substance that causes illness or death when eaten, drunk, inhaled, or injected, or absorbed in relatively small quantities. Emergency medical responders can save patients' lives by quickly recognizing and promptly treating serious poisonings. Some of the routes or poisonings can be classified according to the way they enter the body or by the routes. There are four main routes: ingestion. Poison enters through the mouth and is absorbed by the digestive system. Inhalation, we breathe it in and is absorbed through your lungs or your respiratory system. Injection, typically through a small opening in the skin and is spread through the circulatory system, and then through absorption or transdermally. It absorbs through an area of skin where it has come in contact and spreads through the circulatory system that way. Our patient assessment for poisoning always starts with our scene size up. We don't want to be poisoned ourselves when we are responding to the scene of a poisoning. General assessment for and treatment, follow a patient assessment algorithm or a sequence, obtain a thorough history from the patient, and if not from the patient, from any bystanders if possible. Be alert for visual clues and things lying around or indicators that could raise your suspicions to a poisoning if that's not what you were called there for. And much of emergency care depends on the patient's signs and symptoms. Some signs and symptoms include knowing the history of the poisoning, how they got poisoned, decreased respiratory effort and difficulty breathing or cyanosis around the lips, unconsciousness or altered mental status, dilated or constricted pupils, convulsions or seizure-like activity, excessive salivation and or sweating, and then empty, leaking or spilled bottles or containers at the scene. These can be prescription medications that do not belong to the patient or their own prescriptions that do belong to them, but they have taken excessive quantities. There can also be accidental poisonings as well. So just because someone has taken a poison or overdose doesn't necessarily mean it was intentional. So after our scene size up, we're going to conduct our primary assessment, do our history taking, our sample history through, if we can, ideally the patient, if not, through bystanders, family members, or healthcare providers, and then perform our secondary assessment, and then reassess throughout our patient contact. So according to the CDC, there were 70,737 drug overdoses deaths in the United States in 2017. That number has increased since then each year. In 1999, there were 6.1 drug overdose deaths per 100,000 people, and in 2017, it increased to 21.7 drug deaths or drug overdose deaths per 100,000. Most deaths are due to opioids, fentanyl, heroin, oxycodone, morphine, and hydrocodone. being the mainstays. More than 80% of all cases of poisonings are caused by ingestion. Chemical burns, odors, stains can be found around the patient's mouth. Be alert for unusual breath odors, nausea and vomiting, abdominal pain, diarrhea, discoloration or burning around the mouth. Treatment for ingested poisonings. Identify the poison if you can. Call the National Poison Center. There's your number right there, 1-800-222-1222. It's the same number across the country. Different call centers pick up on your geographical location. So you get a poison control operative that is relatively within your region. If you're unable to contact poison control, dilute the poison if ingested by giving water, and arrange for prompt transport to the hospital. Do not do anything to induce vomiting. A lot of times these poisons can be caustic and can do double the damage on their way back out. American Association of Poison Controls does not induce this or induce the use of Ipecac in children or adults. Activated charcoal is considered more effective and safer than syrup of Ipecac. Although most EMS systems do not carry activated charcoal any longer. Here is a picture of a brand of activated charcoal. It is a finely ground powder mixed with water. Works by binding to a poison, thereby preventing the poison from being absorbed into the patient's digestive tract. Basically, the carbon activated charcoal binds to or absorbs the poison instead of your digestive tract absorbing it. Do not give a patient who has ingested an acid, has ingested a petroleum-based product, or is unconscious. Obviously, if they're unconscious, they can't protect their own airway, they can't swallow. General dosages are 25 to 50 grams for an adult and half of that for a child or a pediatric patient. Serve it in a covered cup and give the patient a straw and have them drink it that way. It is very messy and causes a lot of staining. So if you get it on clothes or fabric, it's very difficult to clean that out. So inhaled poisons occur if a toxic substance is breathed in or absorbed through the lungs. Some toxic substances, carbon monoxide, are very poisonous but not irritating. Other toxic gases like chlorine gas and ammonia gas are very irritating to the respiratory tract, cause coughing, severe respiratory distress. So some of the signs and symptoms down here on your screen. In addition to respiratory distress, you have dizziness, cough, headache, hoarseness, confusion, and chest pain. Common causes of carbon monoxide poisoning include improperly vented heating appliances, smoke from burning buildings or like house fires, and not so much on outdoor fires, but fires that are in a contained area, and then inhaling small quantities of carbon or CO can be very dangerous due to its ability to bind to the hemoglobin of the red blood cells, which, going back a couple chapters, gives you that false oxygen saturation reading. Some of the signs and symptoms can include headache, nausea, disorientation, unconsciousness, flu-like symptoms. If you find several patients together who report these symptoms, remove everyone from the structure or the vehicle and get them to a well-ventilated area. So some irritants like ammonia, often found in agricultural settings. Has a strong irritating odor and is highly toxic. It causes violent coughing and can burn the skin. Avoid anyone who enters an environment containing ammonia must wear a proper encapsulating suit with a SCBA. You should probably be trained on that as well. Chlorine gas is found around swimming pools and water treatment plants. Severely irritating to the lungs and to the upper respiratory tract, causing violent coughing, and it can cause skin burns in a high enough concentration. Anyone who enters an environment containing chlorine must wear a proper encapsulating suit with a SCBA as pictured here. Presence of hazardous materials that are toxic, and those in which there is a danger of fire or explosion should be indicated by appropriate placards. So here we have a couple Class 3 placards for flammable liquids, petroleum distillants, typically used in an immersion and manual cleaning process. These are things like mineral spirits, kerosene, white spirits, and naphtha. Class 9 environmental hazard liquids, liquid substances, and then a Class 8, which is a corrosive solutions and products, things we want to keep off of our skin. Treatment of inhaled poisons. Remove the patient from the source of gas, get them to a well-ventilated area. If the patient is not breathing, begin mouth-to-mask breathing. If the patient is breathing, administer large quantities of oxygen. Backing up to the mouth-to-mask, if they have inhaled a gas, it's probably better to use a bag valve mask instead of mouth-to-mask at first, if you can. And then, of course, arrange for prompt transport. You may have to evacuate large numbers of people first and implement your triage process. Once the evacuation is complete, evaluate and treat the evacuees as necessary. Two major causes of poisoning by injection are animal bites and stings and toxic injection. Some of the signs and symptoms: obvious injury site like a snake bite or sting marks, tenderness, swelling, red streaks radiating from an injection site, weakness, dizziness, and localized pain with itching. Treatment of insect stings and bites. Keep the patient calm and still. This will help slow the spread of the poison and reduce anxiety throughout the patient's body. Wash the site with soap and water. Remove the stinger using gauze wiped over the area or by scraping a fingernail over the area. Never use tweezers or your fingertips to squeeze a stinger because this can inject more of the venom into the patient. Apply ice packs to reduce swelling and pain. This should be done periodically and not left on the area. Prolonged exposure to very cold temperatures can actually increase the likelihood of necrosis or tissue death. Some people experience an extreme allergic reaction to stings and bites and may go into anaphylactic shock. Signs and symptoms of anaphylactic shock are hives with itching, swelling, wheezing, and severe respiratory distress, generalized weakness and unconsciousness, rapid weak pulse, rapid shallow breathing, decreased blood pressure, hypovolemic shock, and cardiac arrest. Treatment for anaphylactic shock: maintain your ABCs, administer oxygen if available, treat for shock in some cases, remove the allergen if possible, if it's still present, and monitor your patient's vital signs. If the patient's condition progresses to the point where respiratory or cardiac arrest occurs, begin mouth-to-mask breathing or cardiopulmonary resuscitation or CPR. Immediately arrange for rapid transport to a medical facility. If the patient does have a prescribed auto-injector, help the patient use it. Support the patient's thigh and place the tip of the auto-injector against the outer thigh. Use a quick motion pushing the auto-injector firmly against the thigh and hold it in place for several seconds. Keep in mind you do not want to cover the end of the auto-injector with your thumb just in case you have it flipped around backwards. But before administering that auto-injector, take a quick glance at the ends of the auto-injector to make sure you're using the proper side or proper end. For snake bites, there are 4 kinds of venomous snakes in the United States. We have the rattlesnake, cottonmouth, better known as the water moccasin, copperhead, and the coral snake. A snake injects its venom into a person's skin and muscles with its fangs. Signs and symptoms are immediate pain at the bite site, swelling and tenderness around the bite site, fainting, usually from emotional shock, sweating, nausea, vomiting, and shock. That last shock meaning hemodynamic shock. There's around 7,000 to 8,000 people are bitten each year in the United States. Only about 5 people die from these bites each year. It's very important to keep these people calm and moving as gently as possible as well. And coral snake bites delivers a slightly different type of poison that may cause these additional problems. Respiratory difficulties, slurred speech, paralysis, and coma, and seizures. Here's an example of a coral snake, which is the venomous variety, and then a very similar looking milk snake. You'll notice the black to yellow coloration on the coral snake, and black to red on the milk snake is the most easily identifiable. But they're not typical. They don't look like your typical pit viper, like your rattlesnakes and your cottonmouths and copperheads. Field treatment for a venomous snake bite is basically the same treatment for shock. Keep the patient calm and still have the patient lie down and try to relax as best they can. Gently wash the bite area with soapy water, gently. If the bite occurred in the arm or leg, splint the affected extremity loosely to decrease movement. You don't want to cause any constriction with your splinting process. And place the splinted extremity below the patient's heart to decrease the absorption of venom. Treat the patient carefully and arrange for prompt transport to the hospital or a medical facility. The only effective treatment for venomous snake bites is administration of antivenin in the hospital. Antivenin is a very expensive multi-dose, long-term type of treatment, which they will administer because there's really no way to know if you had what is called a dry envenomation or a dry bite or an actual envenomation until the damage actually begins, the damaging process begins. So they preemptively administer this antivenin regardless. Absorbed poisons occur. These occur when a poisonous substance enters the body through the skin transdermally. Insecticides and toxic industrial chemicals are the most common. Signs and symptoms: traces of a powder or a liquid on the skin, inflammation or redness of the skin, chemical burns, rash, burning sensation, itching, nausea and vomiting, dizziness, and shock. Ensure that the patient is no longer in contact with this toxic substance. Brush it away. Do not wash if it's a dry chemical. Contact with water may activate a dry chemical and actually make it worse. After removing all dry chemicals, wash the patient completely for 20 minutes using copious amounts of water. That's a heavy flush of water. Don't be gentle or reserved with that administration of water, especially with the post-dry chemical removal. Do not forget to wash out the patient's eyes if they have been in contact with a poison. And if additional EMS personnel are delayed, contact poison control or your medical director for additional treatment information or options. If the patient is experiencing shock, treat them for shock. If the patient is having difficulty breathing, administer oxygen if it is available and you are trained to use it, which you will be. The nerve agents block the essential enzyme in the nervous system and cause sludgem-like symptoms. Four of the most common nerve agents are sarin, soman, tabin, and V agent. Nerve agents can be absorbed through the skin, inhaled, or injected. They are among the most deadly chemicals developed. Small quantities can kill large numbers of people, causing cardiac arrest within minutes of exposure. The sludgem acronym stands for salivation and sweating, lacrimation, or excessive tearing, urination, defecation or diarrhea, gastric upset, emesis, muscle twitching or meiosis or pinpoint pupils. Four of the most common nerve agents are, again, sarin, soman, taboon, and V agent. And these would be most likely to have occurred in an act of terrorism. There are also the accidental exposures. Some additional signs and symptoms for nerve agents include shortness of breath, slow heart rate, muscle weakness, twitching or paralysis, seizures, and loss of consciousness. These all are very similar to organophosphate poisonings, which you would see in a lot of agricultural applications. Here's a signs and symptoms exposure for the SLUDGEM acronym here in the bottom right-hand corner of your screen. If you are called to the scene of organophosphate or nerve agent poisoning, your primary responsibility as a responder is to keep yourself and other rescuers and bystanders from being contaminated. A hazmat team will arrive in their special protective equipment, and they are needed to remove and decontaminate people who are exposed to these agents. SCBAs and encapsulating suits are needed to prevent exposure to rescuers. Always assess your patient's ABCs and support them. Nerve agent antidote kits enable you to self-administer or another person who has been exposed and is exhibiting signs and symptoms of organophosphate poisoning. However, you must have medical direction or approval from your medical director to be able to administer these and have received proper training for the administration of these kits. Duodope auto-injector kits contain an auto-injector that is filled with two types of medications, the first one being atropine and the second one being pralidoxamine chloride. Most EMS systems do not carry those on their trucks on a regular basis. It's usually kept at their base or on a supervisor's vehicle, something of that nature. They are fairly expensive. Okay, so moving on to substance abuse. According to National Survey on Drug Use, 9.1% U.S. population, or 22 million people, have a substance abuse disorder and are dependent on alcohol or other drugs. Substance abuse results in an increased incidence of illness or injury. Even if the primary reason for a call is not substance abuse, it may still be a contributing factor on many calls. Most commonly used or abused drug in the United States is alcohol. It is involved in a significant number of traffic fatalities, around 31% of all traffic fatalities. Murders are 50% involve alcohol, and suicides is greater than 30% are alcohol related. Signs and symptoms of alcohol intoxication are similar to those of other medical illnesses and other severe injuries. Be extra careful with your examination. Presence of alcohol in a system can mask other injuries or medical conditions. It is an addictive depressant drug. Persons physically dependent on alcohol can develop severe withdrawal symptoms, including seizures or delirium tremens, which is the most severe symptom, and it can be fatal. Other signs and symptoms are shaking, restlessness, confusion, hallucinations, gastrointestinal distress, chest pain, and fever. Drugs may be ingested, inhaled, injected, or absorbed into the body. Look for clues that indicate the type of drug and the way it was administered. You will find clues and indicators a lot of times in unconscious patients. One very common thing, if you can't find needles, pills, or burns or anything to indicate that it has been inhaled, if you look inside their mouth, a lot of times they'll have been chewing on medication patches. Abuse of prescription drugs has increased in recent years. So we have amphetamines, which is stimulate your central nervous system. They include speed, ice, crystal, meth, cocaine, also known as crack, coke, rock. There's also synthetic stimulant type drugs such as bath salts. Signs of amphetamine use include restlessness, irritability, and talkativeness. Keep the patients from harming themselves and transport them to a facility where they can be more closely monitored usually for an extended period of time. Pain relievers like opioids and heroin. Yeah, you have Vicodin, Oxycontin, morphine, codeine. Heroin is an illegal street drug that is powerful and it is addictive. It's made from morphine and is particularly deadly when combined with fentanyl. And there seems to be a growing trend of mixing these drugs together as well. Some signs and symptoms of an opioid overdose include slow, difficult, shallow breathing or no breathing, small or pinpoint pupils, weak pulse, low blood pressure, blue nail beds and lips or cyanosis, drowsiness and disorientation, delirium, and coma. If an overdose of opioids can result in respiratory depression or arrest if the patient is not breathing, begin artificial ventilation for them, whether that be mouth to mask or bag valve mask. If a cardiac arrest occurs, begin CPR immediately and arrange for transport to the closest appropriate facility. So what do we have in our kit to combat these overdoses or poisonings? For narcotics, we have naloxone, better known as Narcan, or more commonly known. It's a medication that can rapidly reverse the effects of opioid drugs on the central nervous system. It's now available for intranasal administration or auto-injection. Emergency medical responders can give this medication only if they have been trained in its use and have approval from their medical director. The general steps to administer intranasally: you obtain medical direction per local protocol, confirm the correct medication and expiration date, attempt to determine whether the patient is allergic to any medications. If not, prepare the medication and attach the atomizer to the syringe. Never use a needle for atomizing intranasally. Place the atomizer in one nostril, pointing it slightly upward. Administer 1/2 of the dose into that nostril, and then administer the second half in the opposite nostril. And then reassess your patient and document appropriately. Follow universal precautions. Wear your nitrile gloves. Wash exposed skin surfaces with soap and water as soon as possible if you have received contact from a substance. Use of alcohol-based sanitizers is not really recommended because it may increase the absorption of these drugs. Wash your clothing that has been exposed to opioids, and consider the use of N95 mask if there's a fine dust or particulates in the air. And consider use of splash protection or eye protection if you are in danger of a liquid containing this drug splashing into your eyes. Hallucinogens, PCP, LSD, peyote, mescaline, mushrooms, chemicals that cause people to see things that are not really there. So you'll have convulsions, coma, heart and lung failure, and stroke are some of the more severe signs. Treatment is primarily supportive. Try to reduce the auditory and visual stimulation. Approach each scene with caution, and arrange for transport. Remember, with those types of situations, to always keep yourself an exit. Never put yourself into a corner or your back against a wall. Abused inhalants are intentionally inhaled chemicals that can sometimes be volatile. Some of these substances can be bought in hardware stores. May cause drowsiness, unresponsiveness, seizures, or sudden cardiac arrest or cardiac death. Try to keep the patient calm and still and support their airway, breathing, and circulation. Give high-flow oxygen as soon as possible, and carefully monitor vital signs and arrange for prompt transport to an appropriate medical facility. A patient's reaction to an injected drug depends on the quantity and the type of drug that has been injected. Some of the signs and symptoms to injected drugs can include weakness, dizziness, fever, and chills. We want to support the patient and treat the symptoms that we see. Provide transport to an appropriate medical facility. Check the injection site for redness, swelling, and increased skin temperature, which could be indications of infection, which this is usually a several hours to days post-injection. Provide basic life support. Keep the patient from hurting themselves or others. Provide reassurance and emotional support that prompt transport. Administer Narcan if you have been properly trained and authorized to do so, and avoid classifying or judging the patient. So some intentional poisonings include attempted suicide. Emergency treatment is the same as an unintentional poisoning. The patient will need both medical and emotional support. Emotional support possibly even more so, because they've obviously gotten to the point where they're wanting to intentionally do harm to themselves. Okay, in summary of Chapter 11, emergency medical responders should be familiar with the signs and symptoms and treatment of patients who have experienced accidental or intentional poisonings. There are 4 primary routes in which poisons enter the body, and those are ingestion, inhalation, injection, and absorption. An ingested poison is taken by the mouth. Often chemical burns, odors, or stains can be around the mouth, and the person may also experience nausea, vomiting, abdominal pain, or diarrhea. An inhaled poison is breathed in and absorbed through the lungs. Some toxic substances, such as carbon monoxide, are very poisonous but not irritating to the respiratory tract, while other toxins such as chlorine gas and ammonia are very irritating and will cause coughing and severe respiratory distress. 2 major causes of poisoning by injection are animal bites and stings and toxic injection. Poisoning by absorption occurs when a poisonous substance enters the body through the skin. A person experiencing absorption poisoning may have both localized and systemic signs and symptoms. Many nerve agents are the same types of chemicals used as in pesticides or insecticides, and your role in incidents involving these nerve agents is to keep yourself, your partner, and bystanders from becoming exposed. It is important to pay special attention to the scene safety and not to enter an hazardous environment without the proper training and PPE. Narcan is a medication that can rapidly reverse the effects of opioids on the central nervous system. And we have a couple questions to review. So the most common route of poisonings are injection, ingestion, inhalation, or absorption. The most common route for poisonings is, the answer is ingestion. Then which of the following would not be considered an appropriate management of anaphylactic shock? Is it A, administer oxygen if it is available, B, remove the allergen, C, induce vomiting, or D, immediately arrange for transport? The answer is going to be C. We do not want to induce vomiting. Number 3, which of the following are common causes of carbon monoxide poisoning? Is it A, air conditioning units, B, cleaning supplies, C, improperly ventilated heating appliances, or D, paints and paint thinners? The correct answer is going to be C, improperly ventilated heating appliances. Okay, so that is it for Chapter 11. Go back and review the chapter in your book. Pay special attention to your learning objectives for this chapter. Those are good things to study. We will be continuing on next with Chapter 12. And thank you for your time and tuning in. If you have any questions or concerns or comments or anything like that, email me or your lead instructor for the class or put a message in the class chat. Thank you very much.